So let's get started in terms of system of profound knowledge. So what is the system of profound knowledge? And why is this relevant to us here aiming for zero seclusion? We know a lot of projects fail, and I can think back to my experience in the health service, and a lot of things we've given a go and they've gone wrong, or you've got so far and all of a sudden the priority has changed and all of a sudden that's not the flavour at the moment and things have had to go on hold. I'm sure you can think of some of those projects too. So why was that? Was it about a management issue or a leadership issue? Was it about the people around you? Or was it the methods or approach? Or was the timing just not right? What was it? Well, there was a fellow called Deming who was a physicist, and he had a passion for transforming management. And it's believed that his philosophies transformed Japan post-war into an economic power. Deming developed a theory. Now, don't be put off by the word theory, all right? Don't think, oh, that's an academic term and I need to be worried about that. Because a theory is based on ideas or a group of ideas that help make sense of things, help us understand. This theory, Deming's theory of profound knowledge, is based on the idea that each organisation is composed of a system of interrelated processes and people which make up the system's components. There are 4 components in Deming's system of profound knowledge: the appreciation of the system, the theory of knowledge, psychology of change, and knowledge about variation. And we're going to be talking to you and getting to learn a little bit about that right now. So let's look at a system. A system's got 4 interrelated components. Systems are complex. Everyone within a system must share a distinct understanding and commitment to an aim and purpose, a common aim and purpose. And haven't we heard that a lot already today, the importance of sharing a common aim and purpose? Understanding the system is about leadership, recognising the interconnectedness and interdependence within the system, things being clearly defined, really important to ensure successful flow and continuous improvement. System can perform at its very best when all these components are orchestrated in such a way to achieve the organisation's goal. Each component contributes its best to the system as a whole. Now that's the theory, but what I'm trying to say is that we need to all be pulling together within an organisation with a common purpose and aim and goal. As I mentioned, a system is complex, it's also dynamic. It's subject to changes impacted by the various components. Each person needs to understand their role and responsibility. Deming's system of profound knowledge provides us a roadmap for us to understand organisations and organisational performance. In this diagram, you can see the 4 components that make up the whole. The system has a lot of different layers, from the very micro to the macro, and within those layers are different demands, pressures affecting those that are operating in the system. So what is the aim of the mental health and addiction system? Do we truly have a shared common purpose and goal? We like to think if at your tables you start having just a couple of minutes conversation about what is the aim of the mental health and addiction system, and can you describe some of the parts of that system where you're currently working? Perhaps you'd like to do that now.
Okay, well, I'll bring you back together again. Tricky question. Why do we ask this question?
Because you get a lot of different answers.
That's good. We'll get a lot of different answers. But it's also to stimulate your thinking. If we're talking about a mental health system and what we're doing about it, and we're thinking about from that improvement lens, and we really don't understand or have varied opinions about what is the aim of the system, it can be quite challenging to change that to what we would need to do. So that's part of that system thinking is about what is the aim of the system, and what parts of the system, do I work in, and how are they interconnected? Because the really important bit is that we, as a system that produces whatever it produces, we need to understand the parts and how they work, because You can't just fix one part of the system and expect to get a different output. It is a system thinking. We need to think about the system as a whole, and we're going to do some more work around that. The other challenge is that our systems are very complex, and starting to understand that, and so that we have to think about complexity as we're designing and starting to test and look at our ideas of how we're going to go about change. And these are things that we need to think about as we're moving forward and understanding different concepts around Dr. Deming's system of profound knowledge. And the more that you start to think about it, the deeper you tend to want to get into it. And it's funny that after thinking about this and talking about it, it really did make me go back and think very much about it again and about understanding what it is our system does and how the interconnectedness is so important. So I've talked a little bit about complexity, and we know that healthcare is complex, and we know that mental health is very complex, but it is important to understand that and just keeping that in mind about the complexity of the system that you're working in. And when we talk about seclusion and reducing that particular output of our system, we need to think, we know it's not just an inpatient issue, don't we? And we know it's not just a community issue. It's across the journey that those individuals in our care experience, and we need to think about that as we're thinking about what are the changes that we're going to make a difference and where they may need to be and how we're going to work together. So the theory of knowledge is another component of Dr. Deming's system of profound knowledge, and that's around how do we build knowledge? How do we learn? How do we learn about our systems? And it's also, when you start talking, and I asked people, what is the system and what's its aims? There's lots of different opinions around that. And we know that if we say, actually, take this idea, everybody use sensory modulation 100% of the time, that will fix your problem. That's not going to work, is it? Because people have different beliefs about what does and doesn't work. And we have to understand people's background of what they're coming from. What is it that you're a part of, and what are your beliefs? Why does the system act the way it does? Why do we have seclusion events? Now, if we went round the room, I think that there's probably 100 people in the room, and there's probably 98 ideas around why that happens. And it's quite important to start to understand people's beliefs about why the system works the way it does, so that we can start to get people on board and thinking differently. And that's a lot of it, the value of the co-design as well, is because it's brought that to the surface about what are the beliefs, what are the experiences, and how that might interact and how affect we work. Building knowledge is based on prediction, and we use that in that scientific iterative process. We continually testing our assumptions, and that's the lovely thing about using quality improvement, is that we're constantly building new knowledge. And information and data don't always, we have to start to understand them and create an understanding about what that's telling us, and go on to learn and use that wisdom about how do we change things. We've talked a little bit about appreciation for a system. So I thought it was really interesting about when we walked around the tables about people's different opinions about what is the system that we're working in, what are its components, and what is it really meant to, what is it the product that we're hoping that the system produces. And I think there's real different opinions around that, but it's important to people to start to understand that. The system must have an aim. What does it do? It must have a way of knowing that how is it achieving those aims. And if you want the system to produce something different, you need to change the system, I think is the big message here. And we have a system that works and produces some excellent output, but if there are things in the system that are not the way we want them, that takes a system approach to change them. Knowledge about variation and how the system is performing. And I think that's probably one of the key messages, is about understanding the data that you have to provide knowledge. How is the system functioning? Is it functioning in the way that we expect it to? Starting to understand what data is telling you, and not seeing trends where there are no trends, or special cause when there isn't. And why that's important is about, if you have a system that's producing a reliable result, day in and day out we see that we seclude 8% of the people that are coming in through our unit. If we want it to be differently, we have to start measuring that. If it suddenly changes to now it's at 20 in the next month, is that a bad thing or a good thing? we need to look at that over time, about how the system's producing that, and understanding variation about when do you react to the system and look at what's going on, or it's about understanding when there's signal and when there's noise. Does that make more sense? So when there's signal and noise, we said, if I went around the room and said, what time is it? We would have probably 80 people talk about different times, that it's my watch is it's 11 past 11, some might be 10 past 11, some might be 5 past 11, some might be at 12 o'clock and thinking about lunchtime. But that's just normal variation. What we're looking for is about understanding what the system's producing and how we can input and make different changes that will change the system, or if there are actions that we need to be taking about leaving the system alone and starting to learn what's going on. I don't think that was particularly clear. But we'll talk a little bit more when we're starting to talk about run charts and variation. But understanding what your system's doing and how it's behaving by looking at your data to get knowledge is really important. It's like the psychology of change. And I think sometimes we miss this, we get really into the technical side of change. But change, the technical side of change is a very smaller part. It's about people, it's about people's beliefs, it's about intrinsic motivation, it's about how it works. And I think that's why we like using quality improvement methodology, because it engages more people in our change approaches. It's about relationships, how we relate to each other and within the system, across the system. What we really want to do now is we want to give you a bit of time to start working around that and start thinking about your own projects and the system that you work in, and start to identify some of the things that you will need to consider when you go back to your organisations around appreciation of your system. Start to think about the understanding of the variation, or where you might look for variation in your system, and you'll have these sheets on your tables. So we're going to give you the next 12 to 13 minutes to have a bit of time on this. I'll leave this up. Think about the human side of change. What are the things that you're going to need to consider about how you're going to go about changes, how you're going to engage people, and about how you're going to start to understand people's not building knowledge, their belief about what the system is currently. We talk about zero seclusion as an aim, and people think that's impossible, and that's correct. In the current system, and the system that we have now, it is impossible, and that is why we're looking at a system, and how do we change the system to where it might be possible, and to reduce it and eliminate it in time to come. So it is a lofty goal, and when people give you that we'll never be able to do that. We can't do that with the system that we currently have. We're going to change the system so that we can be safer and more compassionate and reduce seclusion and eliminate seclusion. On that note, we'll finish this session, and David's back with some more wonderful words of wisdom. Thanks.